More than 120 million Americans are now able to get COVID booster shots from Moderna and Johnson & Johnson.
As KXAN's Jesse Tenura reports, the CDC approved the recommendation from an FDA advisory panel late on Thursday.
The Pfizer vaccination.
Okay. Millions of Americans can now choose to get an extra layer of protection against COVID-19.
We now have booster recommendations for all 3 authorized COVID-19 vaccines.
CDC Director Dr. Rochelle Walensky says that choice extends to which booster you receive.
There may be some people who might prefer another vaccine over the one that they received, and the current CDC recommendations now make that possible.
Anyone who received Johnson & Johnson can get a booster 2 months later. For Pfizer and Moderna, those 65 and older or 18 and older who live or work in a high-risk location or have common underlying medical conditions can get a booster 6 months after their last shot. Walensky is especially concerned about pregnant individuals because their vaccination rate remains low.
You should also get your boost during that period of time, and I would say for nursing as well.
White House COVID-19 response coordinator Jeff Zients says locations including pharmacies, doctors' offices, and rural health centers can provide the boosters to eligible Americans starting today.
We have ample supply of all 3 vaccines.
But ultimately, the priority remains getting the unvaccinated their first shots.
We will not boost our way out of this pandemic.
Austin Public Health is one of the groups offering booster shots starting today.
And they hosted a media Q&A session to give an update on the pandemic here in Austin and Travis County. KXAN's Grace Reeder listened in for us. She joins us live in the newsroom. Grace, what do people who need that extra dose of vaccine need to know?
Well, this is going to be the true test to see if APH's booster shot plan goes as smoothly as they've been saying. Most people who got their first doses of vaccine through APH got Moderna vaccines, so there will likely be a wave of people suddenly eligible to get their shots now. APH says they do anticipate that surge, but that this will go much more smoothly than vaccine distribution in February for several reasons. First, there's more vaccine, and there are hundreds more providers to give those shots. Some of those providers, like Walgreens and CVS, also announced today that they're also rolling out Moderna and J&J boosters.
Is there any indication that people getting booster shots might bring us down here to stage 2 in Austin?
Well, yes and no. Austin Public Health factors a number of things into which risk-based guidelines we're in, and if there are less breakthrough cases and hospitalizations, we'll have lower numbers. But overall, it's people who are entirely unvaccinated that are really at risk of ending up in the hospital and in ICUs, and those are the metrics that inform our risk-based guidelines the most. While we're talking about which stage we're in, though, we did hit the threshold for stage 2 guidelines today. The 7-day moving average of hospital admissions dropped down to 14. It's generally taken around a week for health leaders to officially move us to a lower stage of risk-based guidelines after we hit that threshold. So that goes to say if the numbers continue the way that they're going, we could be in stage 2 guidelines in around a week.
Grace, thank you so much for your time. Now, to read more about today's update from APH, head over to KXAN.com and click on this story.